So thank you all for joining again. I suspect there's some new people and perhaps a few people that were with us a couple weeks ago. I'm just going to finish up some of an overview of the emerging evidence about different strategies that work to prevent or reduce violence against women in the family primarily, so intimate partner violence. So I just wanted to introduce really quickly a new initiative called the Prevention Collaborative, which is a network of individuals who are really working to try to bring some of the experience from what we're learning in different parts of the world to strengthen the ability to kind of think creatively about prevention and using not just research, but practice-based learning and also feminist principles. So that's the organization that I'm currently working with, and we're trying to work with groups like UN Women and other groups on the ground to accompany them as they move from perhaps services or other kinds of development programming to really try to think creatively about preventing violence. Just to reflect or remember broadly, the evidence is actually emerging and developing quite dramatically over the last decade about different strategies that have been evaluated in kind of traditional impact, what are called impact evaluations. So an effort to not just look at a program and draw lessons, but actually try to establish whether or not levels of violence are being reduced or fewer women are actually being subjected to violence. And so those programs sort of break down into various different groupings. And you see here on the slide a few. I covered last week some of the issues around gender-aware parenting and community mobilization to reduce violence. And today, I thought I'd just finish up with some of the emerging evidence and strategies around working with couples, the issue of addressing alcohol and mental health as triggers of violence, especially in the family, and then look a bit just on legal and policy reform. So this is just the same thing, showing that many of these different interventions work across the ecological framework, and one of the strategies that's promoted is obviously to try to have combined programs that would have components or alliances at the very least with organizations that work at different levels of the social ecology, from individual to the relationship to community on up to like social or legal. So just with that background, let's just launch into some of the new work that's actually coming out from Africa and Asia around strategies about working directly with couples. Traditionally, this has been sort of a controversial strategy in terms of, from a feminist perspective, the concerns, I mean, it's very legitimate concerns around would it be safe to work with couples? Is it appropriate if actually you have a perpetrator and someone who's being victimized? But one of the things we talked about last week or 2 weeks ago was just the difference in levels of violence that we see around the world, and in settings where 40 and 50% of couples are experiencing violence, or women are experiencing violence from a partner. Generally, what you have is a belief system that's driving this, and also the idea that violence is, or hitting is, a form of appropriate discipline for women. And so gender obviously is a core thing to be tackled, but there's another thing that seems to be coming through in the research in a variety of places, which is that some of the violence is also a function of a lack of basic skills, a lack of understanding about expectations and the nature of consent, around how to communicate or deal with conflict, about how to sort of modulate emotions and to be able to understand and name emotions, and some of the kind of universal challenges that couples have, coming together and learning how to live as partners. And so what we've seen is the idea of developing programs that are curriculum based, working with couples. Usually they'll have a component that's with women, a component with men, and then working together. And we've actually seen quite a few programs be well received at a community level and to be safely implemented. The one I'm going to talk a little bit about is a program called Indashikira, which was delivered in Rwanda, in 4 of the provinces in Rwanda. And it was very much framed as a building healthy and violence-free relationships. And they were couples who were recruited from the general population. So these are not people who are going into this where you know upfront that violence is an issue, but these are just people who agree to participate in a program to improve their relationship. And so it had 24 sessions. It was a combined program that was implemented by CARE, the Rwandan Women's Network, and the Rwanda Men's Resource Center. And they built off of a village savings and loan platform. So the comparison of the evaluation was couples who were recruited from the VSLA, or their partners was in the VSLA, and then they got this additional curriculum that they did as a couple, compared to women who just participated in the economic savings group. And then after the couples went through this program, what they did is they were trained in a subset got additional training and additional opportunities for leadership around community mobilization and activism. So it was actually sort of an adaptation of the SASA program that many of you are familiar with. In addition, they created 14 women's safe spaces, which were drop-in centers at what was there called the sector level. So it wasn't actually in the village. Women would have to travel, but they were staffed by trained facilitators who would receive women. And then if they were interested in going to formal services, they would accompany them. But frequently they also would just do informal support at the safe space, as well as sensitization of opinion leaders. The adaptations in terms of thinking about moving, originally they wanted to do SASA, and it raised a number of challenges, because SASA is actually a program, the way it is designed is befitting if your sponsoring organization is co-located within the community in which you are supporting activists, because SASA traditionally will work with community members and they'll do a bit of training and a bit of work on one's concept, and then people will go out and share that in the community, and then they'll come back in and get a new concept or a new agenda, and they will go out. And so it takes a year or more or 2 for the community activists to actually go through the entire trajectory of programming. And that works if people are right there, but Rwandan wanted to actually work in 4 different provinces, so it wasn't possible to bring everyone in, and every week or every couple weeks. So what they did is they decided to build off of one of the things that seemed to be important in SASA that wasn't anticipated, which was the shifts that were happening actually amongst couples. And so they kept the SASA idea of balancing power within relationship, and so starting a discussion around power hierarchies and gender, as well as the language of power within, so sort of self-esteem and capacity, power to, power with, and then the negative type of power being power over. And people began to use that language to communicate in many different elements of the community life. So they also, to this new adaptation, added some content specifically on emotional regulation, identifying triggers of violence, what were the source of arguments, and doing some what's called cognitive restructuring. So helping people learn simple techniques about controlling their thoughts and reframing when events happened, in order to give couples some skills when they encountered conflict. So this is just a very simple slide looking at the outcome of the evaluation of the couples curriculum piece of this. And what you saw is after the 24 months, they did, or we actually were involved in the evaluation. So there was a baseline, and then at 1 year, and then at 2 years post baseline. So this is 2 years out now from the actual intervention with the couples, and they showed a 55% reduction in intimate partner violence, 52%, now this is speaking for the women, there's also data on the men, but 52% reduction in depression. Interestingly enough, there was, not surprisingly, I guess, a reduction in children witnessing violence, but one of the things that we saw both in the qualitative data as well as the quantitative data is that couples were able to generalize what they were learning about their own relationship to shifting how they were interacting with their children. So there was less harsh physical punishment of children, and less support for using harsh physical means as a form of discipline, even though that wasn't in the curriculum by design. There was reduction in the level of marital conflict, and as well as increases in couple communication and sort of relationship quality. So there were measures around trusting each other and caring for each other and the likes. Come on. It's not letting me. There we go. One thing that I think is really important is they were very committed in Rwanda to wanting to do SASA, but it actually proved quite culturally difficult. And I think it's important to recognize that not every sort of strategy or model is best suited for every setting. And one of the problems is that SASA was designed and first implemented in a high-density urban area of Kampala. And it was based very much on the idea of informal activism, where you'd go to the moto stand or you'd go to the well and you talk to your friends and colleagues, and it didn't have a lot of formal curriculum and the like. The reality is Rwanda, though, is a very formal society, and there are many opportunities of parents' meetings and various things that you can build on. But the idea of discussing things like violence in public spaces was very difficult for people in the first instance. So you see here some of the quotes. It said, "The community activists do not do the informal activism. We push them to go to markets, churches, bus stations, but they are shy. That is related to this new approach because Rwandans are not familiar with this type of thing." So this would be an example where this approach, you could still do the kind of messaging and activism, but it really would have been better planned and worked better if they had built on sort of the cultural assets that were there. And in the end, while the couple's actual intervention had a big effect, the SASA piece of it, the community part of it, did not have any effect. And we think partly that was because it took much longer than people anticipated for the groups to sort of start to feel comfortable in doing some of the activities, and might have had more success, one, if they could have gone longer, if the project had lasted longer, and if it had built more off on the infrastructure that was available in Rwanda. So I wanted to just say a tiny bit about alcohol and mental health programs, because this is an area that actually we don't tend to talk about a lot in terms of violence against women programming. Women themselves talk about it all the time. In fact, if you go out and talk to women about violence, they link very strongly alcohol abuse and the severity, frequency and severity of the abuse that they experience. And what we see is that that link, that association, is repeated everywhere in the world, and it's about the same size, I mean, in terms of impact. Now, what's interesting about that is people often say to me, like, I can remember speaking with the head of the UN Trust Fund, and she said, well, you know, in Egypt, it can't be related to violence because, you know, very few men drink. That's true, but amongst those men who do drink, they drink a lot, and the impact of their drinking on the likelihood of them being abusive to their partners is the same as you see in other settings. So one of the things that people have started to think about is, are there ways that for those couples or those men or women for whom alcohol is a big trigger and a disinhibitor of violence, is there something that we can offer? And there was an interesting intervention that was tested as part of the What Works program, called the Common Elements treatment approach. This actually comes from the field of lay mental health. And what they've done is they've adapted, they've looked at the simplest things that have shown to work for alleviating anxiety, depression, and substance use. And they've put them together into a very simple, almost a, what would you call it? It's like a flow chart. And they train lay people. So these are not psychiatrists or psychologists or even social workers. They train lay people to be able to deliver this structured counseling using a decision tree. And they did a big evaluation trial of this, training people who were identified as already having violence problems, and the man having alcohol problems. So this would be sort of what a booster program could look like if you were doing, let's say, a community program around violence, but there were couples for whom violence was continuing, and the man had a substance abuse problem or the woman had a substance abuse problem. What might you be able to do to help that family? So what they actually showed is that there were dramatic declines even among these very high-risk couples in both IPV and trauma symptoms, depression, and male alcohol use. And that was after only 10 sessions of this lay-led treatment. So here you actually see the evaluation results. So this is on the left, CETA comparing, so 53% percent reduction in the number of women who reported recent intimate partner violence. So It went down by 53% amongst those people who participated in the lay-led counseling, compared to 37% in the control. And likewise with sexual violence, 56% versus 32%. So you see that there was a larger impact amongst those who participated. You also see the similar type thing with the hazardous alcohol scores, which is basically looking at harmful effects of the alcohol, and having benefits both amongst women and men. So leaving aside the alcohol issue then, just one quick comment on the policy and legal reforms. And I think that here's an area where I think we are actually missing some important opportunities. We have focused a lot, and I think appropriately, on trying to reform, excuse me, trying to reform, trying to get domestic violence and sexual assault laws and making marital rape and the like illegal or recognized. But I think what we haven't necessarily looked at is where other types of policy or legal reforms could actually have perhaps even a bigger impact on levels of violence. So, for example, there's a study that we were looking at in India, and what they do is they use what are called, researchers call natural experiments, meaning they're not actually, a researcher's not going in and manipulating anything and giving, an intervention to one group and not another. But when you have a policy that is introduced over time, some people will be subject to that policy much earlier than others, and it allows you to draw some conclusions about the implications of that policy. So in India, they eventually passed a national law for Hindu women that changed their inheritance rights. So it used to be that men would inherit much more than women, and boys and girls. But different states implemented those reforms at different times. And when researchers went in and looked at the impact over time, what they saw was that in the states where the law had changed and equalized inheritance, then IPV fell 17%. You see similar type of examples around things like changes in other forms of family law. So frequently one of the things that keeps women in relationships beyond just economics is concern about custody of children, concern about maintenance, and all of those things. So it's just sort of an observation that we should start to think and look for opportunities to have large-scale impact that might be coming from legal and policy reforms that are different from those just specifically focused on violence. So I wanted to just end, I briefly spoke about this last time, but in terms of thinking through sort of the elements of how do you program or think about a community-based prevention strategy. And this is one that would be at the level of either a village or some, it could be more than one village, or it could be a township, or it could be an urban high density area. But in the middle, what we see is that, I don't even know what that shape is, but is that, one of the core things is, even though my talk and the work that we're doing is focused on prevention, it's key that you need to have the support services and the safe spaces in place, because these things go hand in hand. And they don't necessarily need to be formal shelters or things like that, but you have to think about, is there, where can women go for either emotional support or overnight, or can they stay in the church or whatever it is? So that's a kind of first step. Another thing that's coming through is that we're learning that even though we've had these kind of pillars of activism and programming, either with engaging men and boys, or from a feminist perspective, sort of working with girls and women, is actually what seems to be working much better is that we engage both men and women. And that may not be at the same time, it may be sequential, but that fundamentally it's very difficult for one hand clapping, that kind of idea, that if you're trying to shift what is fundamentally a problem that exists at the level of a relationship, even if one person is clearly the aggressor, it's very hard to shift that dynamic unless both people are receiving support and positive messages and have the support of the people around them. The other thing that is, again, a little bit different than the discourse that we frequently use in violence against women is that the programs that are coming through as being the most successful are not focusing, are using kind of positive aspirational language and talking about taking a benefits-based approach as opposed to a strict accountability, perpetrator victim language approach. That can be, I think, somewhat controversial as well, but the data are showing that people are much more willing to engage when they feel like there's an opening, and even when you get to having couples or communities or whatever analyze their situation and recognize that there is an imbalance of power, they're more willing to take that on board if there's a sense of kind of mutual benefit. So just briefly going through, the first thing on that chart around the outside is just this idea of, empowerment and recognizing that if women themselves don't see violence as a problem or if they've internalized it as somehow their fault, that is an important place to start, because I think people need to have a sense of imagination of a world that could be different and should be different. And so I think if people do start with, working with adolescent girls or whatever, focusing on kind of classic empowerment and thinking about future orientation is an important first step. The other thing is almost all of the programs that have been successful to date have built off of this Freirean notion or adult education notion of critical reflection and problem posing. So meaning that they're participatory, they're not didactic, they're not like kind of telling people how to be. They're very experiential, evoking emotion, and really trying to help groups see their way through and analyze their own reality and reflect back on it, and really see where either behaviors fail to align with sort of what they've learned about, let's say, human rights norms, or fail to align with their cultural values or whatever, but that reflection process. The other thing is that the ones that are more successful have a strong component on actual skills. So it's not just the discussion of gender and power, it's actually giving people skills to identify emotions, strategies for dealing with anger, helping people recognize that a lot of what creates anger is the expectation, you know, like dealing with things like jealousy, dealing with in men, the kind of belief system. And this is actually being imported from some of the work that goes on in mental health, but adapted to a prevention setting. And actually has been, I think, a real help to the programming, and is consistent with what we've learned in other areas around, you know, whether it's adolescent pregnancy prevention or helping women with business development or anything. You need these soft skills in addition to the content. Then this concept around organized diffusion, what we mean by that is that there was a hope in the early days that these group processes, that if you could facilitate some sort of group reflection or whatever, that individuals would then, it would sort of diffuse out into the community or diffuse through sort of friendship networks and the like. And I think it's probably safe to say that that diffusion doesn't happen of its own accord. It has to be planned. So it may vary. So in some settings, it may be, let's take it out through community radio. Other settings may be, let's take the group members and train them to be community mobilizers so that they go out and take the message, but they're supported in that process. It could be a social norms type of intervention. It could be drama. I mean, it really, the point is not the mechanism, or the point is not the means, but that you have to actually plan that step into your programming. Another thing that I think is important, and we do it in our activism, but I'm not sure we always do it in our programming, is this idea of encouraging disclosure. You know, so many, especially in Asia Pacific, with all of the data that you have now, it's so clear how few women have ever spoken about some of their experiences until they're directly asked. And so people have, there's shame involved, and part of disclosing is it's the first step towards getting potentially support, but it's also a step towards destigmatizing and shifting and helping women find each other. And so this notion of breaking the silence, I think, is something that we should actually import into our programming. I think what's important, though, is that we have to prioritize what I call the first responders, which is, if you look at all of the data, what we see is most of the women are actually going to families and friends. They're not going necessarily to the police or even the health services or even women's groups. So what happens is, unless we model and unless our programs help those people respond appropriately in a way that's not victim blaming, that woman is going to retreat back, right? And so I think we need to be thinking more about that ring of people that she is likely to disclose to. Another piece that seems to be an important sub-outcome is encouraging interruption of abuse. And I won't play this, but and if I think most people have probably heard of VAW, but this was been used around India and many other parts of the world. So the campaign to literally help people be able to interrupt safely and communicate subtly that the behavior is not acceptable, but do it in such a way that doesn't put themselves at risk. Because people's major concern about intervening is really not knowing how. And so this is modeling how. And then the final piece is just this idea of collective action. And one of the things that we see is that once you go from the power within to the power to, the final stage is the power with. And people find it incredibly, or it's incredibly helpful to start mobilizing the accountability and everything mechanisms, but it's also helpful for people to internalize what they've learned. So that's sort of just a really short kind of, I hate to call it recipe, but some of the things to think about.
We look forward to organizing the next one. The next topic that we've planned is on the connections between women's economic empowerment and ending violence against women, which Lori will also present and facilitate. So thank you, Lori,
All right, well,
and thank
be
you.
well. Thank you.
Likewise, same to you.